I am a publisher, writer, editor, daughter, sister, auntie, dog mom, and many other things, including currently a cancer patient. But I am not a doctor or medical professional of any sort. What you are about to watch is an episode of my journey through cancer. I'm sharing my adventure with you in hopes that you'll find something here that's comforting and maybe even inspiring. This video is not intended to provide any sort of diagnosis or treatment plan. Please go talk with your doctor for professional medical advice. Day 65, day 2 of treatment is in the books. My grooming has gone all to hell. Got sort of a Boris Johnson thing going on here, but I'm feeling all right. I'm still on the pump for 3 more days of chemo, but I haven't felt any nausea so far, and that's because I'm dosing myself with a few things. The first is prescription drug Zofran. Zofran blocks the actions of chemicals in the body that can trigger nausea and vomiting that can be caused by chemotherapy and radiation. There are other side effects to it. Severe constipation, which is not something you want when you're having the kind of cancer that I'm having. So I'm not taking one every 8 hours as prescribed. I'm taking them basically 2 a day. I want to keep taking it because basically I'm afraid to stop taking it because I don't want to be nauseous. I don't want to feel that way. So I'm kind of walking a fine line between what I am supposed to take and what I'm actually taking. My side effects also include headache, chest pain, dizziness, and I have felt the dizziness, but I don't know if that's from the Zofran or from the chemo drugs. And blurred vision is another side effect you can get from Zofran, and I did experience this the day yesterday. As soon as I got home from the clinic where the treatments are being given, I wanted to go see my mom, and we did, and I stayed. It could have been between 5 and 10 minutes, and all of a sudden I saw 2 moms, and I love my mother dearly, but one is enough. So we came home. And Zofran can also cause high levels of serotonin in the body, and this can cause diarrhea and fainting and hallucinations, and it can also cause nausea and vomiting. So there's that. The other thing I'm dosing myself with is ginger tea. And I make it myself, and my dear friend from Salves taught me how to make this. I use about this much ginger and cut it up into 1-inch pieces, and about this much mint. It smells so good. I cut the ginger up into 1-inch pieces, put it in a pot, and I put in enough water to fill 4 of these. These are 20 ounces. So I'm making basically 4 days at a time. I bring the ginger and the water to a boil, and then once it's at a boil, I turn the heat down and let it simmer for about 15 minutes. And then I take it off the heat, and I chop up the mint and put the mint in. And then I put just a towel. You don't want to cover it tightly with the lid of the pot, but just a towel, and I just let it sit and steep until it's cool, and that can take a couple hours, and I don't mind that. I really like my tea really gingery. And then once that's done, I strain it and put it back, fill up my water bottles, and then I've got 4 days worth of ginger tea to take with me when I have treatments, and then to drink all day. And it's delicious, and I think it's helping with nausea. The other bit of advice that I have, and keep in mind that it's summer when I'm recording this and having my treatments, but it is cold in the rooms where they give you chemo, and where they do the radiation. And I guess it's cold in the radiation room, particularly because, the equipment works and it has to stay cool. But my hands were so cold, and my fingers turned blue and got numb. So I take these are little wrist warmers, but I take them and I use them as little gloves, so that when you're laying in the radiation room particularly, you have to keep your hands still, and they give you a big rubber ring to hold on to, so you can just have something to hold and keep your hands up and keep them still. And this is just enough to keep my hands warm enough that they don't go blue and get numb. So other side effects that I'm feeling, I don't know whether it's psychological or not, but I really feel the pressure in my pelvis being relieved already. It's not gone, but it's not as obvious to me. And I haven't felt any sunburn that they tell you you're going to feel on your skin, but I do feel a bit of a dull ache in my pelvis. The big thing is that I am exhausted. I'm trying to continue to work as much as normal, but every hour I get up and I crawl into bed for 10 minutes, and it's just so delicious to stretch my legs out and just lay there, because I'm so exhausted. So I guess in summary for today, what I'd say is that I'm not sure I'm going to get off this easy in the long term. It's only been 2 days into the first week, and I have 6 weeks of treatment to look forward to. But so far, so good. If you liked this video, don't forget to give it a like, subscribe, and ring the bell. Also, don't forget to call your senators and your congresspeople to demand universal health care. And most importantly, don't forget to vote.